Ladies, have you ever looked in the mirror and thought, my skin didn't used to look like this? Maybe you're breaking out again. Maybe your skin feels drier. Maybe products that used to work suddenly don't. Skin changes started in your 30s, but accelerating in your 40s are real. And it's not just about wrinkles. Today, I want to talk to you about what's actually happening beneath the surface and how to support your skin through those transitions and beyond in a way that is thoughtful and grounded in science. Welcome to Queen City Skin, the podcast where skincare meets science and confidence is always in style. I'm Dr. Elizabeth Rostan, board-certified dermatologist and founder of Charlotte Skin and Laser. We're here to cut through the noise, from social media myths to marketing hype, and bring you clear, evidence-based advice on caring for your skin at every stage of life. Whether you're looking for everyday skincare essentials, the truth behind trending treatments, or lifestyle tips to age gracefully, you'll find it here, because healthy, beautiful skin isn't about perfection. It's about feeling confident and healthy. Let's get started. Hi, listeners, and welcome to Queen City Skin Podcast. Today, we're talking about some skin changes in the skin that affect men and women. However, we're really going to kind of talk about the menopausal changes and where aging is accelerated in women. So a lot of women in their 30s start noticing some changes in their skin. Why is that? I think in the 30s, there's a lot of stress that comes on board. Small children, sometimes older parents, job stresses, balancing everything. And I don't have kids, listeners. I think many of you know that. I have a bunch of dogs, but that's nothing. But what I hear is I got to get them to taekwondo practice, and then there's swim, and we've got a swimming, and then there's away baseball, away soccer. All of this is a lot of time and stress. It starts to affect your skin a lot. And then there's also hormone changes. Your ovaries are not functioning like they did in their brilliant teens and 20s. And I can reference you to the podcast with Dr. Chris Morris, and he used a very eloquent analogy of the band at high school. So in your 20s, your ovaries are functioning like an orchestra, the New York Orchestra, very brilliant. It starts to kind of fade in the 30s. They're more like maybe the high school state band. These are good musicians putting out some good stuff, but they're not the New York Philharmonic. You get in your 40s, at this point, you are the middle school band, and there's lots of tweaks and squirts and bad functioning things that are going on. Well, these affect your skin. So hormonal fluctuations, and this is perimenopause, this is before menopause, it's going on. You may also be having some poor sleep, and that affects your skin as well. The other thing that happens in the 30s is you really stop making collagen too. So these changes start showing up. The other thing that can be happening at these ages is, frankly, the signs of aging are catching up with you. The tanning that you did in your teens and your 20s did not give you wrinkles. You looked great. I can speak to this because I did it in my teens, early 20s. As soon as I got in med school and saw sun-damaged skin under the microscope and skin cancer, I was like, oh my gosh, I'm not going out again. And anyone who knows me can attest to that. But sunspots start showing up. Brown spots, redness, easy flushing, broken blood vessels, wrinkles, texture changes. The skin gets thinner with sun damage. That upper layer is not functioning like it used to. It's thin. You're at risk for skin cancer, and certainly many individuals in their 30s and 40s are getting skin cancer, and easy bruising starts to show up. So all these changes are taking place. I mentioned loss of collagen. What's that all about? So collagen is made by a skin cell called the fibroblast in your skin. The fibroblast makes collagen, elastin, and a little bit of extracellular matrix that gives your skin the resilience and hydration and buoyancy. Well, these little cells quit doing that in the early 30s. So if you think that everything's fine because you haven't reached 40 or 50 yet, it's really not true. They're not making collagen. They're also not making elastin. without stimulus. And if there's a stimulus, they will make some collagen. This loss of collagen leads to changes in your skin, including fine lines, wrinkles, and thin skin. What does the loss of elastin do? Elastin is the stretchy protein in your skin, the elasticity provider, the bounce back. So without elastin, your skin doesn't bounce back. If you snap the neck skin of your teenager, it snaps right back in place. If you do my skin, it kind of stays there. And this is despite working on it a lot. You just lose that elasticity. So when we talk about treatments in the office that restore elasticity or tighten, that's what we're going for. And the loss of extracellular matrix, that's when the skin just looks thin and dull, dry, and not as thick. Again, I'll go back to the teenager. I just spent a weekend with a 14-year-old, and that buoyancy of their skin, we see them in the clinic. The pinchability of their skin is so good, and we lose that. That's the extracellular matrix that holds it all together. All that's taking place in the dermis. Your skin is made up essentially of two layers, the epidermis, or the top layer, and then the dermis. But the epidermis changes too. I said the skin gets thinner. It's twofold. The dermis gets thinner and the epidermis, the upper layer, gets thinner. There is this pattern in the skin called reedy ridge, and they're like little fingers that go down. Well, with age, those kind of disappear, and your epidermis is just sitting flatly on top of the dermis, so easy bruising, and it just doesn't look real good, that tissue paper skin. All those changes, they really start happening in your 30s and 40s. So how do we combat that, right? What do you do? Well, you can be proactive about sun protection using good products. The basic anti-aging we recommend is daily sunblock, antioxidant serum, like a vitamin C serum, and even a retinol. Retinol helps protect your collagen. And then protect yourself from the sun. Hats, clothing. Don't go out at noon. Try to time your time outdoors where you're not getting so much sun, because the sun accelerates all this. You can also do treatments that stimulate collagen. These include laser, light, and energy devices like microneedling, radiofrequency, all the laser treatments, and even biostimulatory fillers. These are fillers that are thinned, and they're put in the skin so that the particles of the filler wake up that fibroblast and have it start making collagen and elastin. Skincare. Be proactive on that in terms of beyond the basics. Peptides can help renew. And really, when you get in your 40s, I think for most women, their shelf of products increases, and then definitely in their 50s, or at least that's true for me. This is also a time when it might be necessary to start medical exams, to look for skin cancers, and maybe treat precancers. We can treat them with liquid nitrogen in the office, creams, and even a treatment called photodynamic therapy. And other podcast sessions, we'll talk more about precancers and skin cancers and how to be proactive there. But this really can start happening in your 30s and 40s. Now, I think the discussion is going to shift a lot more just to women. Women, as we move into our 40s and definitely 50, experience much accelerated aging of the skin, and it's simply due to loss of estrogen. And what does estrogen do on the skin? It helps support collagen and elasticity, as well as the thickness of the skin. It also helps your skin in wound healing. And so as you lose that estrogen, you may notice wounds take longer to heal. They don't heal as well. So estrogen can play a role in all of that. Estrogen also has a role in volume, facial structural volume. So if you look at men and women together as they age, it's very similar, 30s through the 40s. You hit 50, women go through menopause, decidedly. And there's a precipitous drop in the volume of facial structures. These include subcutaneous fat and bone So cheek hollows show up, jowls show up, changes in the jawline, so you start getting more neck. A lot of changes, and women really come in and like, I just don't look like I used to. Also, with loss of collagen, you can have a relative increase or excess of androgen. Okay, if there's a balance between androgens and estrogens, as that estrogen drops, you might see changes of androgen excess. Hair on the top of the scalp is thinning. That's called female pattern thinning, androgenetic alopecia. Unfortunately, dark, coarse hair may start growing on your face, chin, upper lip, maybe a sideburn. You may start to develop hormonal acne. I have women coming in, and they're like, I'm in my late 40s. Why am I having acne? And it might be an imbalance because estrogen is declining. So what can you do about the loss of estrogen? Certainly you can talk to your physician about estrogen replacement. There are treatments for the acne, for the hormonal acne, and I encourage you to be proactive about that. You can do treatments to stimulate collagen in the skin, and you can do treatments that replenish volume in the skin. And I think the replenishing volume, if you start early, you achieve a more natural appearance before everything is depleted, and then you come in and we replace everything. I think you can stay ahead of the game also because even the volumizing fillers can be stimulating for collagen. So I think the fillers can address the volume loss, estrogen replacement, treat the acne, and there's tons of treatments for the female pattern thinning. Little public service message I often throw in, we're seeing patients for skin cancer screening and skin rashes or other things. If they're thinning, I will say to them, there's treatments for this. Just open the door. I like to open the door for patients. How do you support your skin and the other changes through these transitions? You can be proactive about sun protection, good skin care. At the first signs of hair thinning, we can start treatments. A lot of patients ask me, well, when can I stop these? And you don't really have to. They kind of become lifestyle medications. I think they're very safe. They're very well tolerated. Something may happen in the future where your doctor says, I think you need to stop it. But keep in mind, you're already ahead of the game because it's a gradual loss, and you've stopped that loss. So if the gradual loss starts again, you're still ahead of the curve. So you can start early and maintain it forever if you tolerate it well. You can begin doing treatments that help you look good right now. Rejuvenating treatments, polish the skin, remove sunspots, remove redness and blood vessels. You just look great. But they also make the skin healthier. They generate collagen. They stimulate the generation of collagen via the fibroblast. The fibroblast also makes elastin. And there's one other thing, folks, about these treatments that we've learned with the fractional lasers and the vascular lasers. They reduce your risk for skin cancer and precancers. They do this via the renewal, the waking up of that fibroblast. When that fibroblast is woken up, not only does it make collagen and elastin and extracellular matrix, it is a vital cell signaler to your upper layer of skin so that it gets rid of the upper layer of skin, polices, if you will, kicks out the bad cells. That signaling tells the upper layer of skin there's a bad precancerous or cancerous cell there. It needs to go. In the absence of a rejuvenated fibroblast, I can tell you he's just sitting around. He's flat, he's sleeping, he's slumbering. He is what's called senescent. Those cells can proliferate. So waking up that fibroblast can help you look good now, but it gets you in a better position for the future. And I really like that effect of the lasers. I like that we're making your skin look better. It's healthier from a structural standpoint. The upper layer of skin is thicker. The dermis is thicker, as we talked about, these thin with age. You have better collagen and elastin, so structurally you're better and healthier. At a cellular level, you're better. And that's the knowledge that we've come to learn in, I'd say, the last 5 years that I think is just fantastic. And where we go with this, I'm not sure. They're doing some studies on mice that may even reduce your risk of melanoma. So making the skin, I'll just say prettier, making it prettier, but healthier, and healthier structurally as well as on a cellular level, I think is very important, so that you don't have to go through the aging process doing nothing. You can be proactive and you can address the changes as they happen that keep you ahead of the game and keep you looking good and healthy in the present, but also help keep you looking good, healthy, and natural, vibrant as you age. And then we talked about skincare as well. I just think that's critically important for skin health. And, basic cleansing, moisturizing, sunblock, but also things that prevent aging of the skin, an antioxidant, a retinol. But you're going to be battling more dry skin as you get older. And, do you just add more to your routine? I don't know that you do. You will. I will advise you add more. But we're going to modify what you do. Okay, as you move into your 30s, maybe those toners and the harsh cleansers you used in your 20s, they go away, more of gentle cleanser. We get more smart about our moisturizing. You can use a hyaluronic acid serum that holds water in the skin. You can use a light moisturizer containing ceramides, squalene, glycerin that rebuild the upper layer of skin, the barrier, the kind of the bricks and mortar. You can use really thick moisturizers that replenish cholesterol and the lipids in the skin. And then at night, you can even use what's called an occlusive moisturizer. The Elta Intense is an example of that. It almost seems like Vaseline. They just hold moisture in by being sticky and thick. So modifying what you're doing, the adding more comes into play with peptides that can modify your skin's response to the aging process by stimulating repair, by stimulating collagen renewal with those kinds of products. Maybe what we've talked about has hit home for you a little bit. You're like, yeah, I am noticing those changes. What's the next step? I think certainly if you're seeing changes on the surface of your skin that consist of brown spots or maybe rough patches or red rough patches, I think it's time for a medical exam and make sure that there's not any precancers or skin cancers there. For our skincare consults, our estheticians here can guide you into both a productive and helpful anti-aging program, but also skincare to address whatever needs are there. Our laser staff can guide you in removing some of the sun damage via some of the procedures and how these procedures can also renew the skin and the collagen. When patients come in for a consult with me or one of my staff, I try to focus on the most immediate goals and needs. What are you looking for? Let's make sure we achieve something. And whether you know it or not, I'm planning down the road because I want a goal. I want a plan to have you have healthy, good-looking skin 5, 10, and 15 years down the road. For women that are coming to me in their 30s, they're going to have high school graduations and college graduations coming up. In the 40s, some of the same graduations, big milestones, and then moving into sons and daughters' weddings, big milestones, big birthdays coming up, celebrating your 40th, celebrating your 50th, having great-looking skin, having healthy structure, and having done some things that address the changes of aging, I think empowers people to lead a more healthy lifestyle and just take charge of their health. And it can start with skin health, I think, and we can do a lot. And again, these things make your skin healthier from a structural standpoint as well as reduce skin cancer. And that's where I'd suggest you start. There's a lot of venues available to you. Just a quick skincare consult is also a great way to start. That's kind of a broad discussion of changes in your skin from the 30s and 40s moving into perimenopause and menopause. anyone interested in a deeper dive in the changes through your whole body on menopause and what it means, I'll refer you to the earlier podcast with Dr. Christopher Morris about menopause. It's loaded with great information because Dr. Morris is so well versed in menopausal changes. I just thought today we'd talk a little specifically about what you can do on the surface skin changes. So thank you for tuning in. We enjoy talking with you today, and I hope you stick around for more Queen City Skin podcasts. Thanks for listening to Queen City Skin. We hope you're walking away with tips and insights you can trust, and maybe a little extra confidence too. If you enjoyed today's episode, be sure to follow or subscribe so you never miss a dose of skincare wisdom. And if you have questions you'd like us to cover, connect with us at Charlotte Skin and Laser or find us on Instagram at Charlotte Skin and Laser. Here's to healthy skin and feeling your best. We'll see you next time.